Dr. Prada, let's talk a little bit about a tummy tuck and exactly who is a candidate for a tummy tuck.
Well, there are different kinds of tummy tucks. There's everything from a mini tummy tuck or abdominoplasty up to a full body lift type of procedure. And really that just is determined by patient preference and what the surgeon thinks is going to make them look their best. Most patients who've had children are probably going to fall into that category of needing some form of abdominoplasty if they're unhappy with the appearance of their belly. Most of the time that's related to loose skin, laxity of the abdominal musculature, or excess fat on their abdomen.
So if a patient decides maybe they're not quite ready yet for a tummy tuck, they want to lose more weight, does that make a big difference? Will it get better? Will it get worse? What do you recommend?
I think it's determined a lot by how much weight they have to start. If they're significantly overweight, it absolutely helps to lose that weight prior to the procedure. If the patient's looking to lose 15 to 20 pounds, I'd say in most cases an abdominoplasty will still be fine. They may require a little bit of liposuction at that time. I do have a lot of patients who say, well, I want to wait and lose a little bit of weight, come back in 3 months and see. Unfortunately, the majority of the time, those patients come back and their weight is pretty similar. So it's usually at that time that the patient decides just to have it done.
So how much tissue and weight can you remove with a tummy tuck?
Well, I don't often weigh the specimen with the tummy tuck because oftentimes it's mostly skin, and skin doesn't have a lot of weight. A lot of patients think if you do the tummy tuck, they're going to lose a lot of volume from that. In reality, the skin doesn't really weigh too much. It's from the liposuction that we do at the same time in most cases where you can get a degree of weight loss.
So how close should they be to their ideal weight?
I would say if they can be within 15 to 20 pounds of their ideal body weight, that would be good.
Okay. So what actually happens in the surgery for a tummy tuck? What do you do?
An incision is made. That goes basically, it's a very low level incision. Most patients are aware of the fact it does go approximately hip to hip. And during the procedure, what we're essentially doing is elevating the skin and fat off of the muscles. We're tightening the muscles from the breastbone all the way to the pubic bone, and we're redraping that skin and excising the excess skin that's there. And that's providing them with the internal tightening, which is their muscle tightening, and also tightening of the skin on top.
Now you mentioned that incision, hip bone to hip bone. What do patients think about that?
I think most patients, it's the number one concern prior to the procedure is a scar. I find long-term, after the scar has about a year to year and a half to mature, it's typically a very faint white line. I usually place that scar in a bikini level, so a lot of patients who come in wearing a bathing suit, they say it's hidden, or if they wear very low-cut jeans, it's usually well below that. And again, the alternative to that is doing nothing and obviously having the loose skin and fat in the abdomen, in which case they couldn't wear that anyway.
And then you said you tighten the muscle. How do you exactly tighten a muscle?
Well, it's kind of a misnomer. It's not true muscle tightening. There is a layer of tissue that envelops or wraps around the muscle. And what we're doing is we're taking several sutures that are permanent and we're bringing those muscles together, almost like a corset internally. And what that does is it helps reduce the laxity of the muscles. That creates kind of a fullness look. And again, most patients who've had children, that muscle stretches and it doesn't always go back like a rubber band, so it's very important that we do tighten those at the time of the surgery.
Seems like a pretty lengthy procedure. How long is it and what is recovery?
It depends the length of the scar, and that's how we determine, obviously, what type of procedure you're going to need. A mini abdominoplasty procedure may take an hour and a half. A very extended abdominoplasty procedure where we may actually have to go around the patient can take up to about 4 hours. I would say on average it's around 2.5 hours to do a simple abdominoplasty.
So do you stay overnight?
I keep my patients overnight if I tighten the muscles. There are some patients, again, some the men I operate on, and some women who haven't had children, that if I don't tighten their muscles, I don't require them staying overnight. But if I do, the patients tend to be a little bit more uncomfortable, and I like to have them overnight to make sure they're ambulating, they're walking, and that they have their pain in check.
So what is the recovery like?
It's about a 6 weeks recovery in my hands for the patient to go back and do anything they want in terms of crunches, running, and so forth. But after about 10 days, most patients are back to work. they're not doing any heavy lifting. After about 2 weeks, it's a stationary bike. 3 weeks, they may be on an elliptical. 4 weeks, they may be briskly walking or so forth. What I don't want them to do too soon, particularly if I tighten the muscles, is any heavy lifting or running.
Now, before you had talked about the pain pump. Is that pain pump something you can use with a tummy tuck?
Absolutely. I actually use them in almost all my patients who have the abdominoplasty. And that is very good in removing, I would say, about half the pain threshold. And that 50% is pretty dramatic. It gets the patient comfortable enough, usually, to be able to get out of bed, start moving early. And that stays for about 3 days as well, similar to the breast pump.
And how does that device work?
It's a fluid-filled canister that connects to a little fanny pack, and it has very thin wires. These aren't tubes, they're very, very thin wires that go underneath the skin flap, and it's self-controlled. It actually does not have to be monitored by the patient, and it controls the amount of pain medication that goes in.
Now, is there anything a patient can do prior to surgery to help make her recovery easier, to have a better success?
I find if the patient basically starts doing some exercising prior to the procedure, it is helpful. Obviously, weight loss is going to be helpful if it's necessary. If patients tend to be a little bit more overweight, I find putting compression stockings on their legs about a week beforehand does reduce the risks of some complications. If you're over 50, I do require preoperative clearance just to make sure you're okay for the surgery. But outside of that, I'd say just a good, healthy mindset and positive thinking would be helpful.
Okay. What about smokers? Are they a candidate for a tummy tuck?
Well, smokers are candidates, but what we do is we have them quit for a period of time. And in our practice, it's variable in terms of how long we ask the patients to quit. In my hands, I usually ask the patient to quit smoking, and that's total cessation of smoking, no nicotine patches, no gum, for about 3 to 4 weeks prior to the procedure.
Okay, so after a patient, you said usually by 10 days, they're back to work, they come in, they see you. What are patients, can they tell a difference that early? Do they see the results?
They're not going to see their final result, but they should see a difference and a fairly dramatic improvement, particularly on the abdominoplasties. Areas of liposuction are going to swell, and oftentimes you'll find those areas may look more swollen after surgery than they did before. So you do have to give that ample time, and I don't find that the patient has their real final result till about 3 to 4 months out from surgery for abdominoplasty, which is quite different from breast surgery where you get it closer to 4 to 6 weeks.
So what do they tell you then at their 3-month follow-up?
They ask right away, is this pretty much the final result, in which case you say, in most cases you're probably there. Most patients are very happy that they've had the procedure done. I find the satisfaction rate for abdominoplasty procedures is probably one of my highest, and I think the main reason for that is that patients see a bit of themselves from years ago prior to having kids, and that brings a lot of excitement to them.
Did they lose a lot of weight? Did they go down in pant size with the tummy tuck?
Yeah, again, it just depends on what you start with. I had one patient who was a size 16 go down to about a 10 in the procedure with liposuction and abdominoplasty. If you're very petite and you just have simple skin excision, you're probably going to find your pants are going to fit pretty similarly. But the way you look in pants, the way you look in your bathing suit, that's where you're going to get the main improvement.
Great.